as a medical coordinator means that I'm not a specialist, I'm not a surgeon, I'm more a medical manager for the strategy and the medical intervention that we did in Haiti. This part, what I will present is what in general was the situation that we found in Port-au-Prince, in Haiti, and what was the general impact of the needs and surgical needs in the overall activity and overall needs that we found there. I will say also that this part is presenting only the part that Médecins Sans Frontières Belgium is what I'm part of. But if you know, we have other 4 big operational centers, and all the 5 Médecins Sans Frontières were present in Haiti for the earthquake response. But me, I only present one part. So this is, as you know, in the 12th of January, the earthquake was of magnitude 7, and it was touched, the most part this was affecting the capital, and this is one important consequences of the needs and the problem that affected the people and the care of the wounded there. Officially, the impact of this earthquake was that there were more or less 230,000, probably more, deaths, with 300,000 injured. This was small vision of what was happening in Haiti and the situation in Port-au-Prince. Médecins Sans Frontières was present in Haiti before the earthquake with 3 hospitals. But the medical structure, and not only the MSF structure, but the overall health system was practically destroyed and disrupted by the earthquake. And 10 minutes, also 15 minutes after the earthquake, already hundreds of wounded that were going around trying to find help. But that was the situation. This is an hospital. This is one of our hospitals in Haiti. Was 4 stairs and become of 2, and all the patients inside. And our staff was also affected. This is our office. 30 minutes after the earthquake, already, because the people knows that we are around in our area, they come in the office. They know that was not a hospital, but they come in the office and they try to help for search of help. And we have 150 people in the office. In the day 1, the day after on Wednesday, in Martissant, the only structure that was survived, our structure survived after the earthquake, we had already 600 wounded in the compound. They refused, of course, to go inside the structure because they were completely afraid and under shock. In the office, we have 150 cases. We were going around and we found an empty hospital that was not broken down, and we occupied this. In 24 hours, we managed to reopen this hospital. In Brussels, they were working to try to find human resources and sending cargo for help in the field. In the second day, day 2, Martissant, our emergency structure, were completely overwhelmed. Choscal, that we just opened, there were already 250 wounded, severe wounded. In the office, we stopped the admission. We were not able to have more space to put patients and the people that were coming. In Brussels, they were continuing to work to try to find more people and more human resources, with more specialized people to send in Haiti. In 3 days, we have more than 800 cases. Cases means wounded, severe wounded. And this is one of the hospitals that also we found. On Friday, I remember I was there, and we found another empty structure. It was a maternity before. And we asked the director to left us the maternity that was empty, and he allowed us to use the maternity, and we managed to reorganize a little bit the space, because with the 3 structures, the office, the Martissant and Choscal, we didn't have the space to manage correctly the wounded, So he allowed us to open he left us the hospital, the maternal hospital, where we found 2 good operational theaters, and we used this for the wounded. In practically, after 1 week, after the earthquake, we were present in 3 hospitals, Martissant, Choscal, and Chancerelle. We managed to remove the patient from the office because we didn't have anything in the office apart of the basic care that we installed under a tent. And we had 4 OT rooms. We managed to have 7 surgical teams. Surgical teams means surgeon, general surgeon, or orthopedist, with anesthetist and OT nurse and so on. And we had an average of, at the beginning, of between 25 to 40 surgical intervention, major intervention per day. But we didn't do only surgery. Of course, you can imagine the disaster in Port-au-Prince. There were problems of water supply, there were problems of hygiene, waste management. There were problems of laboratory. We didn't have immediately access to blood transfusion, for example. And the people also need normal consultation, also need cesarean section. And we have also a good collaboration with the Nephrology Task Force International. And they come with us in the first plane, in the first cargo, with dialysis machine to care of the crash syndrome. That is also one of the needs that you found for an earthquake. Physiotherapy is also very important, and we had the chance to have a good collaboration with Handicap International, that is another organization caring for the physiotherapy. And with all the surgery that we did in the first weeks, was really important, their presence and their action, an immediate action inside our hospitals. This is one of the problems that we have immediately. This is 1 day of work. And the problem that we have on a new hospital with waste management. And this is some data from only to give you an idea of what we managed to do in the first month. And it's only a small part. It was not, we cannot cover all the needs, but we managed to do 5,000 consultations. This means also for pneumonia, for children with diarrhea, and so on. Hospitalization, not only for surgical care, but also for other complications. Surgery with anesthesia, 750. Dressing without general anesthesia, but without anesthesia or local anesthesia. Physiotherapy section in the first month was 1,500. Mental health support, we have 7 psychologists on ground after the first week. Trying to deal with our staff first, that was completely under shock, and the beneficiary. And the water, we start to distribute water quite immediately in some camps around our hospitals, because there was, on the first days, there were a problem of access for clean water. So what I can say of the first week of activity, we have a big an amount of wounded and burn also, and big problems, because in the first week we had limited resources. We didn't have 300 surgeons or medicine or the nurses already available, and we didn't have immediately the specialists and the right material, of course. Nobody wanted to imagine that an earthquake can happen in Haiti. Haiti is normally prone to natural catastrophes as floods or cyclone. The earthquake was the last earthquake was 100 years before, so we were not ready with the specialized items on ground. And we didn't have a supervisor, surgical supervisor in there, so also for the quality or the decision and the strategy for surgical intervention was not clear. But our objective was to save life on the first days, and this is what we try to do. And also to save, okay, we call this MSF language, jargon, limb-saving activity. And this was mainly with the wounded. The second week, we were also already able to reorganize a little bit the activity and our hospitals to increase the quality, to improve the hygiene. We had more human resources arriving from Brussels and from all around the world. and the supply of specific item arrive with cargoes. So within the second weeks, we saw already an increasing of the quality, and the protocols that we are used to work with were putting in place. And this was also possible because we were already present in Haiti since 19 years, so we have a team on ground. We have Haitian people working with us. We had huge work, and before the earthquake, also with a lot of national staff and intervention. We have a logistic in Médecins Sans Frontières. We have quite a good logistic behind. We can hire plane, helicopters, cars. We have stock that is quite useful in such a situation. Our logistic impact was quite great, and all us as medical people, we are really great we are really thanks the logistic that is fantastic when you have somebody you can work because you have somebody behind that give you the means to work, the electricity, the water, the clean the place, the movement. And we have also one chance with 2 weeks before the earthquake. The mission was refill order big store of fuel. And I can tell you I was there the first week of the earthquake, and not a lot of organizations, they were stuck because they didn't have fuel to put in the cars to move or to put in the generators for the hospital to have the electricity in the hospital. We have the chance that we just refill the fuel stock. And also in Martissan, they just received 1 month before, they just received the medical order with drugs and items for 6 months of work. That is the normal order, and they just received this. So we have the chance to have something already to start the intervention. There was a very high and impressive commitment with human resources. We had 11 expatriates working before the earthquake in Haiti. After 2-3 weeks, we were already 100 and 160 and more. All MSF sent 300 expatriates in the first weeks of the intervention. And we had a lot of people that call us to try to see if they were available to come and to be sent in Haiti for work. It was impressive. And of course, the chance to have Haitian people already there, that they know us and we work with them since years. This was one of the main resources that allow us to work and to have a good impact in our activity. Et voilà. And this is only my presentation, and this is only to give you an overview of what's happening in Haiti. And now I will pass to the second speaker about specific surgical activity in Haiti and the importance of orthopedics that we feel in Haiti. We had collaboration with several organizations, as I told you, the nephrologists. In all the earthquake, we need nephrologists and dialysis capacity because of the care of the crash syndrome. And as you will see after with Dr. Luis, the next speaker, you will see the big needs of surgeon and orthopedists in such a natural catastrophe. We have also good collaboration with Handicap International. I think that it's important to know that when you arrive and you need to intervene in such a catastrophe, you really need the collaboration of everybody and try to put the people together to have the best impact and the best response for such a catastrophe. Thank you.